Hi everyone! In this video, we are going to talk about the topic of pregnancy and constipation.
It is right to ask questions regarding medication used during pregnancy. Pregnancy is an exciting time. However, it can be also a scary time if you are not sure how your medicine is going to affect your baby. Not all medications are safe to take when you are pregnant. Some medications are safe, but others are not, or the effect on your baby may not be known. When you are prescribed for a new medication or you want to get some medicine at a pharmacy, make sure the healthcare provider know that you are pregnant. Tell them about your medical condition, medication history, or any medicine, herbs, or supplement you are taking. Every stage of pregnancy brings different issues and concerns. There are few things or changes to expect in your body. These include muscle cramp, congestion, edging, frequent urination, and also one of the most common ones, especially during the late pregnancy, is constipation. Constipation in pregnant women is thought to be occurred due to the hormone that relax the intestinal muscle and by the pressure of the expanding uterus on the intestine. The relaxation of the intestinal muscle will cause the food and the waste to move slower through your body. Constipation is the common complaint during pregnancy, which means questions about using laxative during pregnancy are frequent as well. Next, we shall see what medication we can actually use to prevent or treat constipation.
Medication for constipation. The medications for treating constipation are generally classified as laxative. There are four common types of laxative, which are stool softener, bulking agent, osmotic laxative, and stimulant laxative. We will discuss further about this in the next few slides. Stool softener. Stool softener allows strain-free bowel movements without stimulating the intestine. It softens the stool, making it easier to pass. Stool softeners can be most effective if you drink plenty of water throughout the day. Examples are alkalis and docusate sodium. Bulking agent is constipation by increasing the volume of stool and making it easier to pass without stimulating the intestine. Regular use of bulking agents is safe and helps make them more effective. Bulking agents are widely used in low-calorie foods, meal replacements, pastries, breads, and cereals. Examples are bran or psyllium, which is found in Metamucil. Osmotic laxative. Osmotic laxative hold fluids in the intestine. They also draw fluids into the intestine from other tissue and blood vessels. This extra fluid in the intestines make the stool softer and easier to pass without stimulating intestine. Drink plenty of water when you use this type of laxative. Example is milk of magnesia. Stimulant laxative. Stimulant laxative makes stool move faster through the intestines by increasing the number of bowel movements and irritating the lining of the intestines. Regular use of stimulant laxative is not recommended. It will change the tone and feeling in the large intestine, and you can become dependent on using laxative all the time to have a bowel movement. Examples are Crectol, X-Lax, and Sinoco. For all the types of laxative, it is not recommended to take stimulant laxative because it might stimulate uterine contraction and cause dehydration in the pregnant woman. Pregnant woman needs more water than the average person. Therefore, stimulant laxative may have adverse health effect on the fetus. The healthcare provider will mostly recommend pregnant women to take stool softener, bulking agent, or osmotic laxative in treating constipation. This laxative will not cause irritation of intestine and are generally safe for pregnant women. Next, we will show you a scenario of dispensing constipation medication for a pregnant woman in a pharmacy. Mrs. Lee is a regular customer in a pharmacy. She is 32 years old and she is entering her third trimester of her second pregnancy. She has recently been having difficulty going to the toilet and is feeling discomfort as a result. She would like to get a product that is safe for her pregnancy. Mrs. Lee is generally healthy and she is not taking any medication except folic acid tablet.
Hi, Elias.
Hi, Mrs. Lee.
Hi, Elias.
Hi, Mr. Lee. Have a seat.
Oh, thank you.
How are you guys with your baby?
Good. Right. But then recently I got toilet problem.
May I know what your condition is, Mrs. Lee?
Actually, this is my second pregnancy. 7 months already. then recently I found that I got toilet problem lor.
Are you willing to discuss this for a while?
Okay, not in rush.
Do you want to talk somewhere private about your condition?
No need lah.
So, what kind of toilet problem are you having?
I feel very discomfort and I feel like my stomach a bit gassy and bloated. And constipation is really annoying me.
Yeah, yes. Can she take this laxative that I used before?
Don't collapse. It's not recommended for Mrs. Lee as it is a very strong laxative. It may cause dehydration and may also cause adverse effect on the baby.
Luckily, we asked you. Oh my god.
Is there any other symptoms besides constipation?
No, only constipation.
Alright. How long have you been having this constipation?
Oh, 2 days already. The first day I thought it would be okay one, but then until now it haven't go off. So I think I must take something to treat already.
Do you try anything to treat your constipation?
No. My husband said right, it's better to refer to the pharmacist before I take anything.
Yeah, this is our second sweetheart.
Good decision. How frequent do you get constipation?
I can really remember, but it's not that frequent actually. And this is my first time to having constipation during my pregnancy.
Okay. Oh, I remember you guys have a firstborn that's around 2 years old, right?
2 years old.
Do you still breastfeeding him?
No, I don't do breastfeeding already.
Alright. Okay. Do you have any medical condition or sickness for this?
She is quite healthy.
Do you take any medicine before this?
No, I didn't take any medicine.
What about supplements or traditional products?
Oh, I do take folic acid tablet every day as a supplement.
Any allergies, Mrs. Lee?
No allergy.
Good. So I'm gonna summarize everything. You're 7 months pregnant, and you've been having constipation for already 2 days, and you take folic acid as a supplement.
That's correct.
I'll suggest you to take metamucil in powder form. Is that okay with you?
I'm okay with the powder form lah, but then will the metamucil affect my baby lah?
Don't worry, Mrs. Lee. It's not a strong laxative. It's safe for pregnant women.
Oh, thanks lah.
So you take metamucil 1 to 2 teaspoonful 3 times and mix it with water and drink it. Take 3 times a day and take it 2 hours after meal or medication. Folic acid for your case.
Oh, so I cannot take it together with my folic acid?
Yeah, because metamucil will decrease the absorption of the other medication you take along.
Oh, I see.
And also drink a lot of water to prevent choking. The constipation should reside in 1 to 3 days. If it resides, I suggest you to take metamucil once a day, or you take food containing high fiber like food, cereals, or fruits to prevent further constipation.
Drink more water, eat more fruits.
If the constipation doesn't reside more than 7 days or any other discomforts occur, I suggest you to stop using the metamucil and go refer to a doctor. You can do everything.
Yeah, got that.
Is there any other questions?
Not for now lah, but then if I got any, I'll come back here lah.
Alright. Okay. So here's the product, metamucil. 1 to 2 teaspoonful, mix with water, 3 times a day, 2 hours after meal, and drink long water.
Oh, understood.
Okay, so it's 3 times a day, 1 to 2 teaspoons with water, then 2 hours after the meal and her folic acid tablet, right? Okay.
And here's a information leaflet on metamucil.
Okay.
You can refer to it if you have any doubts, or you can come here to ask any other questions.
Oh, okay. Thank you, yes.
You're welcome. Hope you get well, Mrs. Lee, and we'll love to see your baby soon.
Okay, bye-bye.
Bye-bye.
Thank you. That's all my laxative.
Thank you.
Why is Metamucil our final product? Metamucil's generic name is Salium, which is a bulk-forming fiber laxative, unlike stimulant laxatives, which irritates the lining of your intestines to make your stool move faster. It is a type of soluble fiber which absorbs water and swells your stool to make it both larger and softer. It also increases bulk in your stool, an effect that causes movement in your intestine. Metamucil has a Category B classification for pregnancy. which means there are no adverse effects found in animal studies, but there are no control studies found for pregnant women. However, it is safe for consumption, generally for pregnant women and breastfeeding mothers. In this case, Mrs. Lee is in the third trimester of her pregnancy and she takes folic acid supplements. Research has shown that there are no interactions between folic acid tablets and xylem. However, metamucil is known to decrease the rate of absorption of other medications, so she has to take it at least 2 hours before her folic acid tablets. The major but rare side effects of metamucil are chest pain, severe allergic reactions, difficulty in swallowing and breathing. The minor but common side effects are abdominal fullness and bloating. Metamucil can also be taken as a fiber supplement and it can be taken on a daily basis. It can also be bought as an over-the-counter product and no prescription is needed.
So here's an advice to prevent constipation by changing your lifestyle. Drink plenty of fluids such as water or juices. Include physical activities such as daily walk or other aerobic activities to prevent constipation during pregnancy. Include more fiber in your diet. Choose high fiber foods such as vegetable, beans, whole grains and fruits. No doubt as a pharmacist, we have to provide professional advices to our customers and our patients. However, it is equally important for us to know how to communicate well with them, clear their doubts, taking their feelings into account and relieve them from their anxiety about their conditions.
As a pregnant woman, we need to be careful about weighing the risks and benefits of taking medicine. We should always talk to our healthcare provider before we decide to take any medicine, herbs or supplement. We can work together with our healthcare provider to determine what course of action is the best for us and our baby. We will feel wonderful during pregnancy and our baby will be happier and healthier if we take good care of ourselves. Keep calm and spend our days looking forward to meet our baby, the wonderful little powers that we will love for the rest of our life.